Well, students across our region are getting ready to return to school, and that means that parents, of course, are busy out buying school supplies and getting their kiddos registered. But a big part of returning to the classroom is making sure that our students are up to date on their vaccines. Now, I'm joined now by Shawnna Rhine. She is with the Southern 7 Health Department. Shawnna, thanks for joining us today.
Thank you for having us. We appreciate it.
Well, of course. And the Southern 7, you guys are so active down there. Do you care to just let our audience know what area you do cover?
We cover the lower 7 counties in the state.
Okay.
So anything south of Jackson, Williamson County, that's us.
That's you guys.
That's us,
okay.
Yeah.
Well, we do know that August is National Immunization Month. That's coming up. Kids are gearing back into school. Tell us a little bit about the importance of that.
Sure. Well, it's not just for kiddos that we're worried about. We're also thinking about adults too. Because,
that's fair.
Yeah, during COVID-19, we saw a drop in the number of people being current on their vaccinations. So we're reminding everybody that now is a good time to start doing that and making sure that is done prior to school starting.
Well, let's go ahead and take that the next step further. Why is that so important?
Well, vaccines, of course, are our #1 defense against viruses, and herd immunity is so important. And we're not at herd immunity status for several vaccines, measles being one of those. And so we want to make sure that everybody is up to date on their vaccines. And if you're not able to be vaccinated for whatever reason, we understand, but talk to your doctor, find out what's right for you and for your children.
Okay. Well, who should be vaccinated? Speaking of that, and then when we go to the doctor, is that just a simple question of, am I eligible? How's that work, Shawnna?
Sure, exactly. Yes, it's very easy to find out if you are up to date on particular vaccines. We think about measles. It's very easy to check that out. But again, we want to be looking at, okay, where are we at going forward and making sure that we've got those vaccines in place. And there are several vaccines that a child has to have before they get into school. And so you can talk with your doctor, talk with your healthcare provider, talk with your local health department, and make sure that you have exactly what you need prior to that first day of school.
Okay, no, and that's excellent advice. And you always want to make sure to have that open line of communication between yourself and your doctor in case there are any concerns.
Well, exactly. And we know that families are going to have those questions.
Yes.
There's a lot going on right now about
really
vaccines.
is.
It's important to have that conversation and do what's right for you and your family. Now, as a healthcare professional, I encourage vaccinations, but again, we do realize not everybody's able to do that.
Yeah, and excellent point. Thank you, Shawnna.
Sure.
Now, when should you go ahead and make that appointment? We're kind of creeping up on a deadline. You're going to be tough to find a spot right now.
Exactly. Well, the first thing to remember is that most vaccinations need to be within your system for about 14 days for you to have a full
For it to be
protection.
active?
Exactly.
Okay.
So, we're starting to come up, middle part of August to be here before we know it.
see.
So now's the time to go ahead and start talking with your healthcare provider, find out what vaccines your child needs. You can get that information from your local school. You can also get it from your local health department and go ahead and get those vaccinations scheduled.
All right. Well, is there anything else that you think is really important to add about vaccinations or just returning back to school and good health as you're getting back into the classroom?
Exactly. Well, when it comes to being vaccinated, we want you to think about others just as much as you are thinking about yourself and your child. Because again, there are people in the school district that might not be able to be vaccinated.
Yeah.
So your child being vaccinated or you being vaccinated helps to reduce that into the community.
Now, if anybody in our audience would like to learn more, where can we send them to get that information?
Sure. Well, of course, you can go to southern7.org.
Okay.
You can also contact your local health department here locally or your healthcare provider. They can help you as well.
All right, Shawnna. Well, is there anything else that you want to add before we go?
Again, if you have any questions, please ask. Don't just assume that what you're hearing is accurate.
Yeah.
Talk with your provider. Make sure you're getting the most current and accurate information possible.
Whenever it comes to your health, there are no stupid questions. None.
No, there are none. You want to make sure you're doing what's best for you and your family.
Thank you so much for coming in today, Shawnna. We appreciate you sharing your expertise.